Hi everyone, I'm Whitney and I'm a dental hygienist. And as a dental hygienist, I see a lot of strange things in people's mouths sometimes. From being able to tell what you ate for dinner last night, to connecting your oral tissues to undiagnosed medical conditions, your mouth can say a lot about you. For the past several months, dental professionals like myself have been connecting people's oral tissues with symptoms of COVID-19. Warning signs like ulcerations seemed to be one of the most common. And now, fortunately, most of us have been lucky enough to have access to the COVID-19 vaccine. And like any vaccine, COVID-19 inoculations have come with their fair share of side effects. That's why it's so important to let the people working at your vaccination site know if you have any underlying health issues or past reactions to vaccines. In fact, most places will ask that you sit for 10 to 15 minutes after receiving your shot, just to make sure you don't experience any type of severe medical reaction. Because chances are, if you do see a dangerous reaction, it's going to happen within minutes of receiving your first vaccine. Now, as most of us know, it's normal for some people to experience a fever or flu-like symptoms in the day or two following your vaccine dose. For some of us, it was harder than others. Maybe you were one of the many who felt perfectly fine, you felt nothing. But regardless, as your body responds to this vaccine and starts making antibodies to attack this new virus, you might see some atypical reactions compared to vaccines you've had in the past. In this case, a mouth rash. According to research conducted at one university, people getting the COVID-19 vaccine occasionally saw oral side effects up to 30 days following their inoculation. Some of these symptoms included ulcers, mouth blisters, bad odor, bleeding gums, and a burning sensation in their gums. The good news is that the few people that developed these symptoms only seemed to exhibit them sometime within the first 30 days and not any longer than that. However, there's always the risk of a serious allergic reaction immediately after receiving any injection. I'm talking about anaphylaxis, which is where your airway swells up and completely seals off your oxygen flow. Anaphylaxis can be life-threatening. And so one of the signs of the onset of anaphylaxis is an itchy mouth or a mouth rash. If you or a family member is allergic to shellfish or other types of food, you know that an itchy mouth usually means you're having an allergic reaction. Typically, the itch or rash quickly worsens within a matter of minutes. So if you are someone who has ongoing severe allergic reactions, there's a good chance that you already have an EpiPen on hand. If this is you, it wouldn't hurt to keep it on you for the rest of your day following your COVID-19 vaccine. And always be sure to talk to the people administering your injection. Set out the 10 or 15-minute wait time and listen to your body. Make sure you feel fine before you leave. When in doubt, wait a little longer. But the take-home message of this video is to really pay attention to if you're developing any mouth ulcers, a mouth rash, or other symptoms in your mouth that seem to persist. If this is the case, go ahead and call your dentist. There are prescriptions and special types of laser treatments available to help address various types of mouth sores. It can sometimes even be something as simple as prescribing a special mouthwash to use at home. The worst thing to do is to wait for it to go away, and it doesn't go away. And another reason to pay attention to your mouth, not only after your vaccine, but always routinely, is to check for the warning signs of oral cancer. Because the warning signs are also mouth sores, especially the ones that don't heal within a couple of weeks. Waiting it out could be dangerous. So if you've noticed something new that looks funny in your mouth and it's been 10 to 14 days with no improvement, whether or not you've had your vaccine, it's time to schedule an appointment with your dentist. I hope this information helps someone. Thank you again for joining me today. Keep smiling, and I'll see you next time.